birth, labor, delivery, and early postpartum. Giving birth is a natural part of life. Most women can give birth without any medical help. Skilled birth attendants, though, guide and support birthing women while being alert for possible problems. This video will show current best practices for a solo birth attendant caring for a mother throughout her labor, birth, and immediate postpartum. When a woman first comes to you in labor, welcome her and her companion. Look at her vaginal area right away if she appears ready to deliver. Find out about her labor. When did her labor pains start? And how often do they come? Have her waters broken? Ask about danger signs such as vaginal bleeding, bad headaches and blurred vision, fever, or severe abdominal pain between contractions. If there is anything worrisome, transfer her to a higher level of care. No, check her to determine her progress in labor and any problems that might affect her or her baby. Explain what you're going to do. Then wash your hands. First, measure her vital signs. Then, check the position of the baby and the baby's heart rate. Time her contractions, how frequent they are in a 10-minute period, and how long they last. Do a vaginal exam if you are trained to do this and the woman gives her consent. Wait till after a contraction. Tell the woman what the results of the exam were and what it means. Record the findings on her labor record or partograph. Encourage the mother to be active. Suggest positions and ways the companion can help the woman relax. If possible, check the baby's heart rate, the woman's contractions, and her pulse every 30 minutes. Now the woman is starting to push and cry out during contractions. The baby will soon be born. Place your supplies on a table within easy reach, including equipment for resuscitation. Explain to the woman what will happen in the pushing stage of labor. Reassure her that you and her birth companion will help her. Let her choose a position that feels right for pushing. A more upright position will help the baby come down. Put on protective barriers to protect yourself from blood and fluids. Use sterile gloves, and if you have them, an apron, glasses, and a mask. Show the woman how to push well. Suggest she open her legs wide, pulling her knees up towards her body with her chin to her chest. Let her push as her body feels.
Yes.
Have her breathe deeply and slowly between contractions. Pushing her feet against you and her companion can make her pushes more powerful. The mother is making good progress. Now you see the baby's head coming down the vagina during contractions. To prevent tears, help the woman birth the head slowly. Stay in close communication with her. Guide her to blow through contractions while you support the vaginal opening. Press one hand firmly over the perineum. With the fingers of your other hand, press gently downward to keep the baby's head flexed. This will allow time for the skin to gradually stretch. Be careful not to restrict the movement of the head. Allow the head to birth slowly and be born spontaneously. Then let the baby's head turn naturally. Help the shoulders out one at a time. Then support the rest of the baby's body as it slides out. Note the time of birth. Lay the baby on his mother's abdomen. Thoroughly dry the baby with a clean cloth. Then change the wet cloth for a dry one. This baby is breathing well, but if the baby is not breathing within 30 seconds, help the baby breathe. Keep the baby in skin-to-skin contact on the mother's chest and cover him, including the head. Now, feel the mother's abdomen to be sure there is no other baby. Then give oxytocin 10 units IM in her upper thigh to prevent heavy bleeding. Give this injection within a minute after birth. Wait until the cord has stopped pulsating before you cut it, at least 2 to 3 minutes after birth. Use a sterile string to tightly tie the cord 2 finger widths from the baby's belly. Tie 3 knots for each string. Pinch the cord with your fingers and push the blood away from the baby. 2 finger widths away from the first tie, tie again. Cut the cord with sterile scissors or a new blade. Do not put anything on the cord stump and leave it open to air. Keep the mother and baby together, skin to skin. At this time, the mother will usually feel some uterine cramping and should soon deliver the placenta. As the placenta naturally delivers, hold it in both hands and twist it to bring all the membranes together. Feel the uterus to be sure it's hard and contracted. There should be very little bleeding from the vagina. If there is more bleeding, rub the lower abdomen to help the uterus contract and teach the woman as well. Inspect the placenta to be sure it's complete and there are no missing pieces. Now check the mother for tears. Using good light, gently separate the labia and check the lower vagina and perineum for tears. This mother did not tear. Now gently cleanse the genital area and apply a clean pad. In the first hours after birth, try not to disturb the mother and her baby. This will give the baby a chance to start breastfeeding. The skin-to-skin contact is also important to keep the baby's temperature in the normal range. This closeness helps the mother become attached to her baby and helps make early breastfeeding successful. Allow the baby to be at the mother's breast for as long as he wants. Check the baby and mother every 15 minutes during the first hour and every 30 minutes in the second hour after the birth. Check the baby for normal activity, breathing, and color. Check the cord for bleeding and the baby's feet for warmth. Check that the mother's uterus feels firm. Check her bleeding, her blood pressure, and her pulse. Before you provide other newborn care, wait until the baby has had skin-to-skin contact for at least an hour. Keep the baby with the mother. Give preventative care according to your country's practices. This may include vitamin K, or preventative eye medicine. Keep the baby warm when you weigh him. Remember, know and follow current best practices at every birth. Support and communication throughout the labor and birth lead to trust and a better outcome. Be vigilant for problems in order to act quickly or be able to transfer the woman and baby.